Now let's get into the anatomical classification of fibroid. Remember that your presentation of fibroid depends upon the size, shape and where it is located exactly in the uterus. First one is the subserosal or subperitoneal type. Next one is the intramural or interstitial type. The third one is the submucosal type and the fourth one is cervical leiomyomas. So let's get into the details of it. As you can see in the picture, this is the subserosal type. So what is the subserosal type? As I already told you, the uterine cavity is lined by three layers. The innermost layer is called endometrium, the middle layer is called myometrium and the last layer is called perimetrium. Okay. The subserosal, the fibroid arises in the myometrium or the middle layer and it is pushed out into the perimetrium. Okay, it is pushed outside. This is called subserosal type. So what happens in the subserosal type is that usually subserosal types are more common and also they do not present with any particular features. That means you might not be having any irregular periods or you might not be experiencing prolonged bleeding or menorrhagia. But if this subserosal type is growing really big and it is developing a pedicule, then that is called as pedunculated subserosal type, which can cause a little bit of problem. If it has a longer stalk, it can cause torsion and also it can cause pressure on the surrounding organs of the body. Next, coming into the intramural type. If you can see, this is the intramural type. What is intramural type? There is fibroid in the middle layer of the myometrium and it is growing like this. It is putting pressure on both the sides. So what is it is doing? If you can see, it is just altering the shape of the inner cavity of the uterus. So what happens in this intramural type of fibroids is that it will alter the shape, giving into fertility problems. So you will have problem being or getting conceived, and not only that, problem because you will not be able to hold the baby for a longer period of time, which will lead into recurrent abortions. This intramural type can cause abortions, and not only that, it can cause severe menorrhagia. What is menorrhagia? Prolonged bleeding for a longer period of time. That is more than 70 ml of bleeding per your menstruation, per each menstruation, and also prolonged bleeding can cause anemia, fatigue as well as weakness. Next, coming into the submucosal type. This submucosal type, the fibroid will start in the myometrium or the middle layer and it is protruding inside the uterine cavity. This will also alter the shape of the inside of the cavity, leading into recurrent abortions. Not only that, remember, intramural will cause menorrhagia more particularly, but this submucosal can cause irregular menstruation. So there is difference in the cycles each time you are experiencing. Sometimes the cycle can occur for every 10 days, sometimes for every 15 days, sometimes for every 20 days. So it differentiates, and also the bleeding sometimes can be very scanty or it can just be spotting. Sometimes it is very prolonged. So these differences in the menstrual cycle are usually caused by submucosal type, which is produced in the myometrium and it is growing inside. Subserosal produced in the myometrium, growing outside. Submural growing in the myometrium and enlarging like this. So we understand the differences. Then coming into the cervical part. Cervical part is usually doesn't give a lot of symptoms if it is not big, but if it is big, it can cause dyspareunia, that is pain during intercourse. And not only that, if it is pedunculated, it can make you feel a little bit of burden down in your abdominal area. You will feel like something is pulling you down. That can be because of pedunculated cervical fibroma or fibroids. Next, coming into the stages of fibroid. Why should we discuss about the stages of fibroids is that the last stage of fibroids can cause severe pain, infection, fever. So what is the first stage of fibroid? As I already told you, it will contain the myometrial part or the muscle as well as the fibrous part. So in the stage 1, you will not be seeing any sort of collagen production. But in stage 2 and 3, you will start experiencing collagen production. If it further goes or the size increases, then that will cause hyalinization of the collagen, or hyalinized collagen will be present. And this hyalinized collagen in the end stage can cause necrosis of the fibroid or sudden collapse, where it will outgrow its own blood supply and it will collapse or become necrosed. and this necrosis can cause infection which can eventually lead to hysterectomy if not taken proper medication. Let's get into the consultation part at Fidicus Homeopathy. Here at Fidicus, we have two kinds of consultations: online consultation and offline consultation. In online consultation, we have two options, which is audio consultation and video consultation. If you are not staying anywhere near the nearest branch of Fidicus, you can get in touch with the given number. You can consult us through the audio call or through the video call. We will get in touch with you. You can share your investigations with us and we will give you doctor consultation. And not only that, we will be providing you with higher grade top rated medicines which will be delivered directly to your doorstep. If you're staying in India, it will take about 3 to 4 business days. If you're staying in USA, it can take up to 3 to 5 business days. And apart anywhere from this, it can take up to 4 to 8 business days for your medicine to be delivered at your doorstep. If you're staying near the nearest branch, you can come and contact us in person where we will be giving you doctor consultation. If you're watching this video and you're suffering from fibroids and you want to cure it, you can consult us at Fidicus Homeopathy. You can consult us through WhatsApp, call or ping a message through this number. If you're suffering from fibroids and you want to relieve it and cure it and you have homeopathic physicians near you, why do you want to opt for Fidicus Homeopathy? Here at Fidicus, it is highest chance of health and we follow these three principles. First is the highest success rate that we experience. Second is the transparent treatment. There is no gray area with the patients. It's always black and white where we give you what sort of plan we are following. And not only that, the personal care here at Fidicus is top notch. So if you want to opt for homeopathy, try choosing Fidicus Homeopathy. Thank you.